In this video, we will review the bones of the hip. We will begin with a brief look at the hip socket, known as the acetabulum, before moving on to review the bony features of the largest and strongest bone in the body, the femur. For a more detailed look at the pelvis, be sure to review the previous video in this series. And for a more detailed look at the distal end of the femur, be sure to watch the upcoming video on the bones of the knee. The acetabulum is a large concavity on the lateral surface of the pelvis that makes up the socket of the ball and socket hip joint. It is formed by the fusion of all three hip bones, including the ilium superiorly, the ischium inferiorly and posteriorly, and the pubis inferiorly and anteriorly. The crescent-shaped surface here is known as the lunate surface and is covered in smooth cartilage that articulates with the head of the femur. The depressed region here at the floor of the acetabulum is known as the acetabular fossa, while this section that looks almost like a missing piece in the acetabulum is known as the acetabular notch. Although it is not shown on this bony model, the rim of the acetabulum is normally covered by a fibrocartilaginous structure known as the acetabular labrum. The labrum serves to deepen the socket of the hip and increase the articular surface area. Moving on to discuss the bones of the proximal femur, we will first orient ourselves to an anterior view. This is the lower portion of the ilium, this is the pubis, and this is the anterior portion of the acetabular rim. The large, rounded portion of the femur here is known as its head. It is covered in smooth articular cartilage and forms part of the hip joint. Just below the head, the bone tapers to an area known as the neck. The neck connects to the upper portion of the femoral shaft, and where these two structures meet, there are two large projections of bone. One located laterally, which is known as the greater trochanter, and one which is located both medially and more posteriorly and is known as the lesser trochanter. Where the neck meets the shaft of the femur, its anterior surface is marked by a roughened ridge known as the intertrochanteric line. Similarly, a more prominent ridge marks the posterior surface of the femur and is known as the intertrochanteric crest. This disarticulated model also allows us to see the shallow depression here on the head of the femur known as the fovea. The posterior aspect of the femur is marked by a number of raised roughened areas that serve as sites for muscle attachment. To reorient ourselves, here is the lesser trochanter, here is the greater trochanter, and here is the intertrochanteric crest. Below the lesser trochanter, this raised area is known as the pectineal line. Lateral to that, the roughened area on the bone here is known as the gluteal tuberosity and serves as a portion of the insertion site for the gluteus maximus. We'll turn our model sideways now to be able to see more of the femur, and note that both the gluteal tuberosity and the pectineal line blend into this vertical structure known as the linea aspera. It is considered to have a medial lip and a lateral lip, both of which are important sites for muscle attachment. Although it is quite far from the hip joint itself, The roughened adductor tubercle is also an important site for muscle attachment. We will conclude our discussion of the bones of the hip by taking a look at two very important structural angles of the femur. The first of these is known as the angle of inclination, and it represents an angle between the neck of the femur and the shaft of the femur. This angle is typically around 125 degrees. When the angle is increased to significantly greater than 125 degrees, it is referred to as coxa valga, whereas an angle significantly less is referred to as coxa vara. The second angle can be a bit more challenging to visualize, but if we rotate the femur to take a superior view and we place it so that the distal ends, the condyles, lie flat on the table, then we can observe that the neck of the femur is rotated to be turned slightly upwards or anteriorly. This anterior twisting of the femur is known as anteversion. And because about 15 degrees of anteversion is considered normal, anything less than this is considered to be retroversion, and anything significantly greater than this is considered to be excessive anteversion. Ultimately, the mechanics of the lower extremity depend on many factors, including this angle of torsion, the angle of inclination, the orientation of the acetabulum, and the structure of the other bony portions of the lower extremity.